Oh, this is unbelievable. Like, honestly, at first, I was like, there's no way this thing is going to work. I mean, it's just this little thing,
You get that a lot.
and it's unbelievable. Like, it's just unbelievable. For me, it's been life-changing. Go get a dolphin. I had a mastectomy 4 years ago, but 25 years ago, I had a C-section with twins and then a tummy tuck 10 years later.
Mm,
Never dreamed the scar tissue was an issue. 4 years ago, when I had the mastectomy, I had so much trouble. I lost the mastectomy. I had all kind of on the left side, all the way up to my shoulder. Nobody knew why. I mean, the pocket ruptured. I stayed tight on my left side, my left hip. For 2 years, I have been in physical therapy and lymphatic therapy, but for physical therapy for a tight left hip and shoulder issues. And when I was in lymphatic therapy this round, my lymphatic therapist said, I think your issue is not lymphatics. You didn't lose any lymph nodes. You had a prophylactic mastectomy. She said, I think you are ate up and drowning in scar tissue. So she started using the Dolphin on some of my areas because, like on my left hip, when I had the C-section, I had a dehisced wound. I mean, I was in my 20s. I didn't understand, but now I understand that's where I have like literally it's like two baby fists or a walnut still in the shell. It's that big of amount of scar tissue down on my left hip. It was adhered to my pelvis bone. Physical therapy just kept telling me my muscles were weak, doing stretches, and she's like, no, this is scar tissue. So she started doing some dolphin, but obviously she only had so much time because we also had to do lymphatic massage for her to bill for the session. Like she had to do lymphatics too. So she told me, she said, I think you would benefit from buying these things to use at home because my scar is hip to hip and I have mastectomy scars armpit to armpit. So
right.
I said, okay. So I bought them and I started doing them at home. And literally the second session in physical therapy, as I was telling her, I never dreamed anything up here from doing my C-section. Never. I was trying to loosen my hip. My hip loosened. My hip, it's not perfect because it's been so tight for so long, but it is loosening. Unbelievable. But I have had a mound here in my neck since for 4 years. I have been to a lung doctor because, they say your lung apex or whatever's up
You're
here.
a nurse practitioner also, correct?
I'm
So
a
you have,
registered nurse. Yes.
yeah, so you're a registered nurse, so you certainly have knowledge and contacts that the average person would not be access to.
Yes. I just, I mean, this big mound formed here. And of course, they did an ultrasound, then they did a CAT scan. Then they did sent me to a lung doctor. They sent me to an ear, nose, and throat doctor. They sent me to a hematologist to make sure it wasn't something blood related, like a blood cancer. I literally for a year saw doctor after I did 3 CAT scans, saw doctor after doctor, and finally they told me they're like, we don't know what this is. We've got nothing for you. It's a tight muscle. So then physical therapy started taping it, which I sent in pictures of it taped. For 6 months, I wore tape here and it did nothing.
Right.
After I did 3 treatments on my scar my C-section scar, which I have a lot of work to do. I mean, my C-section scar is huge, but I looked in the mirror one day and I'm like, what the heck? Like it's gone down. I
Right.
mean, it was big and it was big every day. I couldn't even believe it. I showed my lymphatic therapist and she's like, I can't even believe that. She goes, but your C-section scars can affect your shoulders.
Oh,
So
sure.
I've had tons of shoulder pain and shoulder issues through my mastectomy. I'm not having that through here anymore, but this is unbelievable. I
Right.
mean, never would I have expected that. And I imagine it'll probably go completely flat by the time I'm done. When I had my hysterectomy, that was obviously a traumatic surgery for my body because she had to open me up. She had to remove scar tissue. She had to remove the adhesions, all these things.
Mm.
After that surgery is when this started, the knot in my neck, the big thing. But also, that's when I lost my reconstruction from the mastectomy because my left pocket on my left shoulder all got so tight, literally from my shoulder to my hip, and my pocket ruptured.
Right.
So I believe it was all the fascia and everything,
It's
but
all
nobody would
connected to the
listen to
fascia.
me.
Yeah.
I had 6 surgeries in 20 months, so I've been researching this a lot and I stay constantly inflamed. I think this vagus nerve thing is going to be a gift to my lymphatic system as well, because I know that I am in a constant sympathetic state. My cortisol is high, my adrenal glands, all of that. I saw a functional doctor and got tested, and my cortisol is super high too. So that has to help that, which is affecting my inflammation and lymphatic.
The
I feel
outcome.
like this is just life changing, these two little things right here.
Well,
I
it
mean, my
is for some
lymphatic
people.
therapist bought
Yes.
the whole kit because I told her about it. My lady that I go to privately, she bought everything. I think you even talked to her. She said, or somebody did, Sonia. She bought everything because I was so passionate telling her, and she saw this. I have never felt so failed by healthcare until I had this. And my husband's in healthcare too. So, I mean, it was traumatic. I'm so excited. You don't even know. Like, my belly stays so, I don't know if you can see, stays, and I haven't really, because I had a tummy tuck. So I've always had a flat belly, but now it stays, like you can see here, it's just full of fluid and swelling.
That's stress. So
Yeah.
I think we're on the right track. Do you have any other
I am
questions
so
for me now?
excited. Oh, this is unbelievable. Like, honestly, at first, I was like, there's no way this thing is going to work. I mean, it's just this little thing,
We
you know,
get that a lot.
and it's unbelievable. Like, it's just unbelievable. For me, it's been life changing. I mean, the mound of scar tissue, which obviously, y'all, I can only tell you, you can't feel it, but all my therapists have felt it. It was just hard, and it was like two little fists in there, and it was literally adhered all on my pelvic bone. And now it's just like a little wad, and it moves and it's soft, and my hip will move and stretch, and it's just crazy.
So if you were to just say, what would you say to the women who have C-sections and health problems from your new knowledge now? What would you tell them?
Go find somebody who has this machine. I mean, I've told everybody I know lately. I mean, it's unbelievable. Yes, go get a dolphin.
Yes,
I believe that 100%. Thank you so much. Have a good day.
thank
Thank
you so
you.
much,
All right, bye-bye.